What are the main challenges facing health professionals in Burkina Faso?
Je tenais à vous remercier pour le choix porté sur le Burkina Faso pour la réalisation.
First of all, I would like to thank you for choosing Burkina Faso for this program, and I would also like to thank WATHI for choosing me. So, regarding the challenges facing health professionals in Burkina Faso, it must be said that Burkina Faso, like other West African countries, is facing several challenges. One of the challenges we can cite is the availability of human resources for health if we know that health is a vital need and that everyone has the right to it, and therefore health personnel must be as close as possible, and this requires that we have a large number. So the first challenge is really the availability of sufficient numbers of human resources. Another challenge is quality. When I talk about quality, it is to take into account the need to have several categories of health professionals given the pathologies that we encounter. I'm talking about specializations in the medical field, and we do not have large numbers of specialities that we are unable to cover. For example, in the field of infectious diseases, we do not have enough doctors specializing in infectious diseases. If we take the field of radiology, we also do not have enough personnel in this sector. In addition to that, on the issue of technical platform, we need state-of-the-art equipment to treat various ailments. This is a problem in almost all West African countries, including Burkina Faso. The other element that constitutes a challenge for health personnel is really stability. That is to say, the retention of health personnel in their positions. We note that there is a high rate of movement of healthcare personnel due to many opportunities because there are many non-governmental actors who also intervene in the healthcare field, which means that there is strong movement towards these structures. And there's also the question of motivation.
Nous prenons le domaine, par exemple, de la radiologie. Voilà, on n'a toujours pas suffisamment de personnel dans ce sens.
A question that often comes up in the health field is different countries.
Donc, en plus de ça,
Yes, indeed. This question always arises because health is a very demanding field. It is a job that is done 24 hours a day, 7 days a week, with fairly high risks. So the staff also expects motivation to be up to the task. So it is a permanent problem. The recommendation made by WATHI to face the challenges are very relevant in my opinion because they are recommendations that come from a diagnostic analysis that was done on the basis of which the different recommendations were formulated.
And so, is it relevant to you? Is it relevant to Burkina Faso?
Oui, toujours Burkina Faso.
Yes. WATHI recommendations are very relevant for Burkina Faso. If we take, for example, the question of budgets, public policies should still monitor the budget allocated to the health sector. If we take the question of accessibility, the reduction of the average radius of access of the population to the health sector, this is a very relevant recommendation, and in Burkina Faso, we are working to reduce and do everything so that within a distance of 5 kilometers, we can have a health structure. In the area of recruitment, we are also making a great effort because every year, the state allows us to recruit a fairly satisfactory number of health professionals. In the area of assignments and recommendations made by WATHI to control the assignment of health professionals have been implemented.
La santé est un domaine très contraignant parce que c'est un travail qui se fait 24 heures sur 24, 7 jours sur 7.
The citizen think tank WATHI, which you know well, has proposed a series of actions to ensure the training of sufficient human resources in the field of health, including mental health, the equitable allocation on the national territory, and their effective supervision. Are these recommendations relevant to Burkina Faso? If not, please tell us what measures you have adopted in Burkina to address the challenges you mentioned earlier.
Oui, les recommandations sont très pertinentes pour le Burkina Faso, si nous prenons...
In the area of assignments, the recommendations by WATHI to control the assignment of health professionals have been implemented in Burkina Faso and have helped to balance the distribution of human resources. In the area of specialization as well, WATHI's recommendation is very relevant and current because it takes into account the mental health component in the training of health personnel, because with the difficulties we are facing, it is necessary to take into account not only the health personnel who work in precarious security environments, but also the populations who are in the different localities, who this recommendation should lead the public authorities to focus on these areas to improve the technical platform. But I wanted to add that the recommendations of WATHI is what we should also see get in different states to integrate the community into public health policies. During our last exchanges, I insisted on this issue. Public policies must understand the issue of health is not an individual issue, but a collective issue that concerns everyone, so that each citizen should integrate all policies and should be an actor of his own health. This is an element I would like to insist on, and that could help provide better care.
Et la recommandation faite par WATI est une recommandation très très pertinente et actuelle, à savoir prendre en compte le volet santé mentale